especially the guest speaker for today, Dr. Bisi, members of the press, ladies and gentlemen. It's a great pleasure to be here with you today to talk about something that is so important, that affects thousands of us. As long as you are a woman, we are told that there's a chance that 1 out of every 12 women will have breast cancer in their lifetime. That's big. Well, Dr. Bisi would prove that, would either agree with me or discounting us, but I think she will agree with me. So there's a high lifetime risk for breast cancer. And it's not just what is written in the books. We also see it in our practice. A lot of women die of breast cancer. So when the opportunity becomes for us to interact with the best mind in the world as far as breast cancer is concerned, we took advantage of it. And who am I talking about? Is our own Dr. Bisi. She's recognized by Forbes magazine 2017 as the #1 breast cancer oncologist in the United States of America. And by extension, I would say arguably, that means she's one of the best in the world. Yes, exactly. So, and if we have someone like that, a shining star from Africa, from Nigerian origin, we must be able to take advantage of it. So yesterday we had a dinner with the doctors who treat breast cancer. And it was a beautiful one because they are the ones that will be around when she has gone back. And then this morning we were on NTA to talk about breast cancer. For those of you who watched the program, it was quite enlightening. And then today we are here to talk about everyday people, those who are not doctors. So I'm sure our language will be such that everybody will understand, and you will have opportunities to ask questions. Now, I want you to understand that the impact of this program is beyond this hall. We'll probably have less than 300 people here today, but with the power of the press, which is fully well represented here, this message can go to every nook and cranny of this country, and we will ensure we do that. So it's a partnership. I work in partnership with Alliance Hospital and AXA Mansard, and here we are delivering a wonderful program. And I want to urge you to listen attentively and ask questions where necessary. Ignorance is the worst enemy of mankind, because it's what you don't know that will harm you. So I want to thank especially Dr. Bisi for accepting to run with us through this course. And so far it's been wonderful, and I know that this is the high point of our itinerary for this visit. And this is just the beginning, because from now we're going to start building bridges. And I know, like I said on NTA this morning, there will be opportunities, because over there are foundations that want to cater for the less privileged people. She may be able to link us up with people over there who can give us free drugs and some other things that can lessen the burden of breast cancer in this environment. Thank you for coming. God bless you.
So what I'm going to be talking about really is trends in breast cancer management, and I'm going to talk over the next 20 to 25 minutes about trying to answer several questions that you might have. So this is kind of the outline of my talk. I'm going to talk about how common breast cancer is worldwide and specifically in Nigeria. I'm going to be talking about what is cancer and what is breast cancer specifically. What are the risk factors to lead to somebody developing breast cancer versus the other person? And then I will talk about how we can try to prevent breast cancer and what we can do to detect cancer early and what to do if you actually find the lump by yourself. Then I'll talk very briefly about how we manage women with breast cancer, and then I'll talk about common myths that we hear about breast cancer, and then I'll take any questions that you might have. So the first thing I wanted to talk about is a very common myth that still goes around, and this is that cancer is a disease of developed countries only. This probably was the case several decades ago, but as the world has become smaller and as low middle income countries are now taking on the habits of better developed countries, we've also taken on their diseases such as cancer. And unfortunately, in low to middle income countries now, we actually now bear majority of the share of worldwide cancers. So these are charts from GloboCan, and GloboCan is an organization of the WHO, and what they do is they try to determine the incidence and prevalences of cancer worldwide. And so what this chart shows here is that the less developed regions are in red, the more developed regions are in blue. And if you look at this graph, this looks at the cancer incidence, so that is the new cases of cancer developing worldwide. We see that the less developed regions have greater than 50% of the new cancer cases worldwide. And in terms of cancer-related deaths, so mortality, people dying of cancer deaths, unfortunately, the less developed countries such as ours account for about 2/3 of all worldwide deaths from cancer. So this obviously is a huge public health problem. I don't mean to bore you with statistics, but this just these are statistics also from GloboCan, and what we see here are all cases, so all cancers, and this is specifically breast cancer. And so what we're seeing is that the incidence of all cancers worldwide is about 14 million. And if you look specifically at Nigeria, we have about 100,000 cases of cancers a year. Now, in terms of deaths, the worldwide deaths are 8.2 million, and people dying in Nigeria specifically, 71,000 people are dying every year from all cancers. If we look specifically at breast cancers now, in all over the world, we have about 1.7 million cases of breast cancer being diagnosed every year worldwide. And specifically for Nigeria, we have 27,000 cases a year. And unfortunately, about half of those women die every year in Nigeria. 14,000 deaths from breast cancer every year just in Nigeria alone. So this really is, these are very disturbing numbers. So really, breast cancer is the top cancer in women all over the world, and is also increasing, particularly in developing countries, again, because we've taken on the habits of the more developed world. And again, majority of the cancers here, unfortunately, are diagnosed in late stages where the cure rate is much less. And of course, breast cancer detected at an early stage is fully curable. So what is breast cancer? So starting from the basics, the breast is made up really of three organs. So the lobules, right over here, the lobules are where milk is produced. And then the ducts are the other parts of the breast, and the ducts are tiny tubes that take milk from the lobules to the nipple. And then the stroma is everything else, so the fatty tissue, the connective tissue that is around the ducts and the lobules. So cancer basically is abnormal growth of cells. So cells in our body keep regenerating with time. We lose cells, for instance, we lose skin cells every day, and cells are always being regenerated. But what happens is that the body has checks and balances to keep cell growth at a particular in equilibrium. So there's not too much cell turnover and there's not too much cell growth. So when this equilibrium is destabilized, what we see is that one cell will just take off and will start dividing very, very quickly. And that really is what cancer is. And so these cells that divide very quickly, they divide faster than the normal cells. And what they do is they now go to invade the normal tissue. And once they invade the normal tissue where they started from, they can spread to other parts of the body through the bloodstream, spread to vital life-sustaining organs like the lungs, the liver, and that's when cancer kills, really when it spreads to vital organs. Having a breast cancer in the breast doesn't kill anybody, because the breast is not a life-sustaining organ. That's why the breast cancer can be fully treated if it's removed and if extra treatments are given really to sterilize the rest of the body. It's when breast cancer spreads to life-sustaining organs like the lungs, the liver, the brain, that's when it kills. So usually breast cancer starts in the ducts, the lining of the, where the milk passes through, or the lobules. When it starts in the duct, it's called invasive ductal carcinoma. When it starts in the lobules, it's called invasive lobular carcinoma. So what causes cancer or breast cancer? To be honest with you, we don't really know the specific reason why cancers happen in one individual versus the other individual. But what we think is that it's most likely related to changes in our genetic material, DNA. And these changes can either be inherited in the form of genes which are passed on from one's parents. So for instance, if one has an inherited mutation in a gene called BRCA1, you might have heard of Angelina Jolie. She had this inherited mutation passed on from her mother who had ovarian cancer. And the breast cancer, there's a higher risk of breast cancer developing in people who have this inherited mutation. And so she actually had prophylactic bilateral mastectomy to prevent breast cancer. So these changes can be inherited. Changes can also be acquired from aging, environmental factors, like lifestyle, obesity, alcohol, and what have you. So specifically looking at risk factors now, risk factors are really anything that can increase the chance of, or increase a person's chance of getting disease. Risk factors, one can have several risk factors. It doesn't necessarily mean that one will develop the disease. It just means that the chance is higher than an individual that doesn't have a risk factors to start with. So there are many risk factors for breast cancer. Some of these risk factors are modifiable. They can be changed, whereas most of the risk factors, unfortunately, are not modifiable. So these are just some of the risk factors here. This is a little bit of a busy slide, but I'll walk you through. So the number one risk factor for breast cancer, of course, is being female, and that is something that we cannot change. The overall risk of breast cancer is about 12%, and that translates to 1 out of every 8 women worldwide will develop breast cancer in her lifetime. The second risk factor is aging. Cancer in general is a disease of older individuals because, the body has seen a long time to acquire more damage to DNA through environmental factors. The average age of development of breast cancer overall worldwide is about 62 years old. But personal history is also a risk factor. So having one individual having had breast cancer, there's always a higher risk of that person developing a second breast cancer than somebody who didn't have breast cancer to start with. Family history is also a very strong risk factor. For instance, if there are multiple people in the family, particularly first or second degree relatives with breast or ovarian cancer, that's a very strong risk factor for an individual developing breast cancer. I talked a little bit about genetics. About 10% of breast cancers are hereditary, where there's an inherited mutation in a gene which is passed on from either one's mother or one's father. There are also certain non-breast cancer problems that can increase the risk of breast cancer. That's something that, if somebody has a lump and is biopsied, the pathologist will read a biopsy as perhaps something called atypical ductal hyperplasia, lobular carcinoma in situ, radial scar. These are some of the things that can increase one's risk of breast cancer. There's a very common very common benign breast condition called a fibroadenoma, also commonly called a breast mouse. That does not increase one's risk of breast cancer. Postmenopausal hormone replacement therapy, which is basically, hormonal pills that a woman can take when she's going through the change of life, going through menopause, to decrease the symptoms of menopause, such as hot flashes, night sweats, This strategy can increase the risk of developing breast cancer. Recent hormonal contraceptives also increase the risk of breast cancer. Hormonal oral contraceptives can increase the risk, but what we've seen is that once you discontinue the oral contraceptive, the risk goes down after 10 years. For Depo-Provera, there's also an increased risk of breast cancer, but that risk also goes down after 5 years of discontinuing the Depo. DES exposure. DES is diethylstilbestrol, which is a medication that was being used between the 40s and 60s to decrease the chance of a woman having a miscarriage. And so what we found was that women who had DES and also their offsprings also had a higher risk of developing breast cancer. But DES is no longer used anymore. An individual will receive chest radiation for instance, if a young adult has a disease called Hodgkin's disease or Hodgkin's lymphoma, chest radiation is part of the treatment for that condition. And so radiating the chest, during that time, they will also radiate the breast, and we see these women developing breast cancer later on in life. In the past, there was also radiation being done for childhood croup. It's no longer done, but children who had radiation for those illnesses also later on in life now develop breast cancers. So other risk factors include black race. So actually what we've seen is that African Americans are actually less likely to develop breast cancer, African Americans and blacks. But what we've seen is that when they do develop breast cancer, we are more likely to die from breast cancer than white women. And we're also more likely, unfortunately, to develop a very aggressive form of breast cancer called triple-negative breast cancer, which is more deadly than another form of breast cancer that usually affects white women. Not having children, so never having a pregnancy, or having children later on in life, so after the age of 30, is a strong risk factor for breast cancer now. Unfortunately, sometimes we cannot really prevent this. A lot of people now are going to school, university, and so they're delaying starting a family, and unfortunately, that puts a woman at a higher risk of developing breast cancer. The higher number of menstrual periods a woman has also increases the risk of breast cancer. How will a woman have more menstrual periods throughout her lifetime? That's by starting the periods early, which is not something you can control. So starting one's period before the age of 11 or 12, or going through menopause later in life after the age of 55. So you have more time in your life to have menses, and that puts you at risk for breast cancer as well. Breast density is also a risk factor for breast cancer. Breast density is not really what you feel, but it's something that is read on a mammogram. If you ever have a mammogram, you might have seen on the report that the breast is very, very dense. And unfortunately, black women have denser breasts than white women. And so because of that, we're also at a higher risk of developing breast cancer. Breastfeeding. Not breastfeeding has been shown to be linked to the very aggressive form of breast cancer that black women have, called triple-negative breast cancer. And so what we've seen is that breastfeeding multiple children for as long as you can, particularly greater than 1 year, is actually protective against triple-negative breast cancer, again, which preferentially affects black women. Physical activity, being sedentary, not being active, increases the risk of breast cancer. Being overweight, obesity, that also increases the risk of breast cancer, particularly breast cancer developing after menopause. Alcohol use is also a risk factor that has been proven recently, and the risk for breast cancer goes up as the more you drink. And so what they found is that a glass of wine is 5 ounces, and drinking a glass of wine every day increases the risk of breast cancer by about 2 to 3 times. And 1 glass of wine, I think, is equal to about 1 bottle of beer.